What are the dangers of self-medication? Self-medication is simply the use of medication for treatment or whatever purpose without the prescription or guide of healthcare professionals. Physical pain symptoms may be difficult to escape without medication, but some medicines are more addictive than others. Some of the drugs people commonly use to self-medicate include stimulants like meth, Adderall, or other similar medications that increase energy and focus while combating depressive symptoms. Central nervous system depressants like alcohol, benzos, and sleep aids. Opioids, including heroin, OxyContin, Vicodin, or pain relievers that enhance relaxation. Marijuana to elevate mood, relax, and take a break from reality. Prescription and illicit drugs may be used for purposes of self-medication. Anyone who suffers from physical or emotional discomfort may be tempted to self-medicate. These dangers of self-medication includes: self-medication might seem right at first, due to the immediate pressing needs of the body, but you need to consider the potential side effects of such uninformed actions. These dangers include: 1. Overdose. No doubt when drugs are not prescribed, there are tendencies that you may be eager to use the available drugs in your possession for treatment based on the way you feel and the symptoms perceived at that time. The body of every human has a specific quantity of a drug needed at a time, and this could be determined by diagnosis, age, body weight, gender at birth, administration route, time of administration, environmental factors, disease condition, genetics, and many more. When you consume more than required, it's simply termed overdose. 2. Drug addiction. Self-medication can make you become a drug addict if you become so obsessed with it, so watch and stop immediately. 3. Allergy. Self-medication can lead to allergic reaction, which could manifest with signs and symptoms like hives, rash, or fever. 4. Habituation. Habituation is different from addiction. Here you find yourself seeking to self-medicate whenever you feel sick, but in the case of addiction, you find out that such person cannot do without taking drugs even when not sick. 5. Worsening of ailment. Ailments could go from bad to worse if inappropriate medication is used due to self-medication. 6. Incorrect diagnosis and dosage. Incorrect diagnosis may not only be problematic as in the case of antimicrobial drug resistance, but could be disastrous in the event of untoward reactions as a result of usage of some drugs, which could vary from mild nausea and vomiting to life-threatening blood dyscrasias and arrhythmias. The list of dangers of self-medication does not end there, but could be more brutal, as seen in cases of 7. Permanent disability and even fatal, leading to 8. Premature death. This is the reason why you must avoid self-medication at all cost. How to stop self-medication. 1. Consult a doctor. A doctor will give you proper prescription and advise on what to expect during and after the course of your treatment. 2. Seek help from people around. Informing your family members and loved ones, neighbors, or even people around would suffice, particularly when you need urgent treatment or medical attention. 3. Learn from other people's mistake. Histories are meant to teach us lessons, and negative histories are deterrents that should guide us away from wrong repetition. Bad outcomes of those who have suffered from problems caused by self-medication should prevent us from thinking of it at all. 4. Attend a rehab. If your doctor advise rehab session, or if you have tried all means on your own but no positive result, please go for rehab. 5. Self-motivation. Determine not use medications without prescription. 6. The pharmacist assistance. A pharmacist would guide you and ensure the doctor's prescription are followed, although some play a huge role in the issue of self-medication in a bid to make a lot of money, but this should be discouraged. 7. Government regulation. The government and other regulatory bodies should supervise the sale of drugs by the wrong people in the country. they should ensure that they confiscate and prevent illegitimate sale of drugs. Although it's saddening that the global prevalence rate of self-medication ranges from 11.2% to 93.7%, depending on the target population and country. We can make it happen. Let's stop self-medication.